Next, I want to move on to some very good coding clinics that empower the coder, that allow the coder to make some decisions and save us the trouble of having to go through the trouble of having to query physicians when that happens. And here you have the use of a report to confirm catheter placement. And the questioner asks, when coding the placement of an infusion device, such as a PICC line, the code assignment is based on the site where the device ends up. That's just one of the basic rules about device placement, vascular device placement. And the questioner asks, for coding purposes, can imaging reports be used to determine the end placement of the device? A very reasonable question. And the answer is, when the provider's documentation does not specify the end placement of the infusion device, the imaging report may be used to identify the body part. And this is a terrific coding clinic because it speaks to how we actually end up doing work. You will often see a PICC line being placed and the documentation telling us that the patient is going off to radiology to confirm the placement of that line. And the documentation can be read, and based on that documentation, we can then indicate the endpoint based on the radiology report. Worth pointing out that the Coding Clinic third quarter 2013 has an extensive explanation of how to actually report the placement of a PICC line if you wanted to review that process as well. And I recommend that very useful Coding Clinic as well that we're not going to take the time to review here today. The other coding clinic that actually proves itself to be very useful is also about using imaging reports. And this is a very useful coding clinic because it does two things. It refers us to a previous coding clinic that tells us advice has supported the assignment of a more specific fracture code based on imaging findings when the physician has documented the diagnosis of a fracture. Q1 2013 tells us that when a fracture is being documented, we can go to the radiology report to determine the exact site if it is not given to us in the physician documentation. So this coding clinic refers back to a previous coding clinic before asking the question, does this same advice hold true for other conditions that can be better specified based on imaging reports? And the question is asked, for example, if a patient is diagnosed with a cerebral infarction or hemorrhagic stroke, can the imaging results be used to identify the specific vessel associated with these conditions? And the answer to this coding clinic is, yes, it's appropriate to utilize reports to provide greater specificity of an anatomic site. Therefore, if a patient is diagnosed with a cerebral infarction or hemorrhagic stroke, it is completely appropriate to utilize the imaging report to report the site of the infarction or stroke, something in ICD-10 that the diagnosis classification allows us tremendous specificity for site of artery involved in the hemorrhage or stroke or hemisphere or location within the brain of the stroke.